What threw me so much after the treatment was suddenly my job was over in the warrior mode, and I felt that I could relax. And that was a big mistake because I was so ill prepared for the emotional journey.
Outside support after treatment was very crucial for me. While I was having treatment, I think I was just too debilitated to go out and seek a support group. I knew they were there, but I did join a support group afterwards.
I had a friend who suggested that I look at participating in a triathlon. I did the triathlon, and I wasn't very good at it, but I started it and I finished it, and it was exactly 1 year from my breast cancer surgery.
Just because I was finished with my treatment did not mean I was finished with my cancer experience, and that was something I was going to have to live with every day for the rest of my life.
Now that my experience is behind me, what I'd like more than anything to do is to be able to help the next person in her emotional journey.
I really felt like I needed to do something to help fight cancer. Otherwise, everything I went through, my experience was almost for nothing. You know, it was the way I moved on into healing.
For most women, we treat the cancer, they go on with their lives, and they do great, and they never have to worry about cancer. That being said, every woman is worried about recurrence.
And eventually I came to realize that fear belongs in the future, that it, one, might not happen, and two, if it does happen, the fact that I've thought about it doesn't make it any easier to deal with.
I really found what that allowed me to do is to see just how many of the people around me, the doctors, the nurses, the technicians, the receptionists, were doing this not because they had to, but they actually chose this area to work because they wanted to help.
I think the thing that I like best about working in the realm of breast cancer is that as I look back on doing this now for the past 10 years, these patients almost universally become my friends through this process, and that working with them is unlike working with any other kind of patient. It's a tremendously rewarding experience for me. I think it's a very helpful experience for them.
One of my final thoughts is just how much the Palo Alto Medical Foundation has embraced the advocates in the community and helped use us to help put their survivorship care plan together.
I was very lucky that I had very good care, I had very good treatment, I had a great caregiver. And what I've since realized that not every woman is as lucky as I am in that respect.
I was told that I would have a team of doctors, but I wasn't expecting them to be so wonderful, so patient, so caring.
I think everything went the way it was supposed to. My mother's feeling great 3 years, after her last chemo, and continuing with her life. I mean, I think it's really for her too, like, this is my life, these are all the things I want to do, and and it certainly has brought us much closer.
Probably the biggest thing I can tell a newly diagnosed patient is to take one day at a time.
Now that I've been through all of this, I live life so much better now, so much more zest for life.
As one of my my physicians said, years from now you'll look back on this as a blip on the radar. And that's exactly what it is.
I realized that there are things about my therapy, my treatment, my cancer that I can't remember anymore. And I think that's good. I mean, it's not something you need to dwell on for the rest of your life. You deal with it at the time and you move on.
If there was something that I would say to any newly diagnosed person is, you will be okay.
Having cancer wasn't the worst thing, it wasn't the best thing, but I got through it, and to that it's a good thing.
I'm alive, I'm healthy. I perceived myself to be healthy even though I had a diagnosis of cancer. I may have cancer, but cancer doesn't have me.